All right. You ready, Katie?
A tortoise arrives, seeking medical shelter.
Hey, how's that?
Hi, good. How are you doing? Doing good.
You know, I have one of these.
Yeah.
His name is Cletus. Tell me about this baby.
Earlier today, her little neck looked like a balloon. This whole cuff was swollen. And
I can see the abrasion right here.
We got Katie about 4 years ago. My daughters are very upset. This is one of their favorite pets, and we knew we had to get Katie taken care of.
I see it here.
You see something there?
Yeah, right here. We scratched it.
Yeah.
Are we outside sometime?
Yeah.
Have you seen any other animals out there? Anything we could have something bit? Because you see here.
Right.
We'll just clean that up. I just want to take an X-ray just so I can get a better look. Be right back.
All right.
When I'm looking at Katie, I see all these abrasions. So it leads me to believe that Katie possibly was attacked by another animal. I can see some swelling. So you poop on me? I gotta be awful slow to get pooped on by a turtle. Get something pretty slow. Katie left me a rather large stool sample, so I think her back end is working just fine. I'm just hoping the wound on her neck doesn't run deeper and compromise any of her vertebrae. We got some tears in that neck, Paul. It went through, something bit. You can see the channels where it bit down. I'll be darned. Let's go get Mom.
All right.
Dr. Cook.
Yes, sir.
Hey, sometimes I'm thinking this is getting personal. Every time I touch this turtle neck, he craps on me.
All right, Doc.
Come on back, guys. So, you see this side? You see that swelling? Something bit us on the head.
No,
Maybe raccoon or cat.
that's not good.
Well, the good news is everything else looks fine. I think with some pain medicine and stuff, we should be fine.
Okay.
Sound like a plan?
Yes, sir.
All right, I'm gonna show you my turtle too. All right. My game plan is to get Katie's wound all cleaned and disinfected. Then I'll give some pain meds, some antibiotics, and some cream. But before letting this client go, she has to meet Cletus, my resting tortoise. Cletus is the man. Well, this is Cletus. This is mine. You see that neck? That's where we wanted to look.
Yes.
But something chomped down on you, baby.
Poor Katie.
It's always cool to have office pets that I'm able to kind of relate and show, I have the human-animal bond as well.
Cletus didn't poop on you?
He did not.
Okay.
So one of the things I try to show my clients, especially when I have young clients, is I'm not just a vet. I have pets that I love, and I just want to show them that the love for our pets runs very deep. All righty. I'm gonna need y'all to be my veterinarians at home.
Yeah.
All right, so I got some cream here, right?
Okay.
This area, especially where the abrasion is, and even if we go in all on this side, then we should do fine.
All right. Well,
But-
this is your future exotic vet partner, so.
I like it. So you gonna come help me take care of some turtle?
Yes, sir.
Cobras?
Yes, sir.
Oh, we're in the same place. Nice to meet you. Pleasure, dear.
Thank you. I'm relieved that it wasn't worse, and I'm glad that she's gonna be okay. My daughters are over their tears, so that's worth a lot. She's looking a lot better.
That was super nice, man. You showed the little girls your old Cletus the tortoise.
People come in here with anxiety, and these girls were really worried. We gotta treat the animal, we kind of relieve the anxiety of the people.
Yeah, man, like the saying goes, we treat both ends of the leash.
That's a big thing, but what if it's something that don't go on the leash?
Like what?
A fish?
We treat both sides of the glass.
What if it's a bird?
We treat both sides of the cage.
How about a cobra?
I'm not sure, but I do know that one side of the cage, I don't want to be on.
Makes sense.
Dogwood,
Oh, that's wood.
get out.
Come here. Yes, I love you too.
Misty the cat makes a comeback at the clinic.
What's up? What's up?
Doctor, hi.
Hey, what's going on?
Oh, it's so nice to see you.
You doing all right?
We are.
So, is that name still Misty?
Now it's Mr. Misty.
Mr. Misty.
He doesn't care as long as he gets fed.
Exactly.
Misty is actually a male, as we discovered a couple weeks ago when Dr. Hodges went to spay him. He was homeless, and we had no clue. And even though I've had 15 cats, I was confused.
Let's check him out there, Paul.
Little gender misidentification.
It was just.
Oh, it was so funny.
It's a veterinary gender reveal. Mister was in here for a spay. That turned out to be a neuter. We got everything done, but one thing I noticed, the eye was filled with a lot of gunk. So I sent home some medicine to see if I could start clearing it up and see if the eye felt better.
So what are we going to do about that eye, Dr. Hodges? I'm so worried about it. I keep putting in the medication.
Now that the inflammation is really gone out, I'm gonna show you something. You see that area?
Ooh.
You see that hair going inside?
It's hair?
Yes, ma'am. It has what's called entropion.
Oh, my.
Entropion is basically when the eyelashes have inverted on the eye and they're actually rubbing against the eye. As you can imagine, this will be very irritating and also painful. And in some cases, can cause loss of vision. You see that hair on the eye?
Oh, I do.
What happens is closing and then scratching the eyes.
Oh, my. What can you do about that?
So I'm gonna take a piece of the bottom out and then we're gonna open that eye so at least we can see it, we can save that eye.
Poor baby.
Paula, let's put him on the surgery schedule.
Yes, I want him fixed.
Yes, ma'am.
You're my pussycat. Yes, I love you.
We're gonna get
My
him
sweet
fixed.
baby.
What we're gonna do is remove some of the parts of the eyelid and do an entropion surgery, so hopefully this kid can see. Hey, boy, this may be one of the worst ones I've seen, to be honest. Real nasty.
So we got DKTs for that one. Did it for that cat.
Tyra,
Then we have
what you got down there?
What's up with this?
Oh, wait.
Are you model walking? Are you strutting like Tyra
Do I
Banks?
look like it?
You gotta do the turn too. You gotta do the model turn.
Oh, now I hurt my knee.
Oh, okay.
You know, so I got too much grip right now. See, I don't
Can't do too much.
do like this.
Yeah, there you go. Strut your stuff like a peacock.
Oh, yeah, I was about to say, hold up now. It's kind of like a chicken or peacock. I don't want
It's
to
a
be like
peacock.
that.
Peacock's nice and proud. Yeah, puff up your chest, shoulders back, walk it out.
Chin down. You gotta have that look.
Get it, get it, get it. Yeah. There you go. Okay, okay. I like it. Nice walk action. Look at you, right?
Look at you with some swag.
Okay.
Oh, thank you. I have swag.
You got swag.
You got swag.
You got swag.
Now, all right, I'm gonna stand right here.
Oh,
can see the
my
whole-
goodness. Look at that.
You can see the whole eyeball now.
Oh, I wonder what his vision's like.
Well, you got scar tissue of it. We're gonna do different things. I wanna heal all the cornea first. So I got the cream, and then I'm gonna got some drops that's gonna help you with the cornea.
Okay, good.
And then may come back with a type of medicine that's gonna help dissolve the scar tissue on the eye. It's gonna take a little while.
Oh.
But we'll hopefully get some of this sight back.
Oh, the precious baby.
Reuniting Misty, or Mr. Misty, and the owner is a good thing. She definitely loves that kitty cat, and I totally understand.
Thank you, Dr. Hodges. You're such a sweetheart. I knew I could count on you.
No doubt.
Once again, Dr. Hodges pulled it out. He's done some awesome things with my critters through the years, so I'm not at all surprised. Thank you.
You're welcome.
Come on, baby. Come on, pumpkin.
Paisley the pup is in with postpartum issues.
Hey, dear. Tell me about this baby.
We got her on July 6th. The lady we got her from, she had two of them that looked a lot alike.
Okay.
And I think maybe she got them confused.
Okay.
Because when we got this one, she was pregnant.
Oh, man.
And we didn't know she was pregnant
Yes, ma'am.
until she started popping puppies out on the 3rd.
Oh, man.
My pup, Paisley, my daughter actually got her as a gift from me after my husband passed away in May. And she thought I needed the companionship. And I think there is a serious connection there between Paisley and I. She ended up with 4 puppies.
Okay.
They nursed her the first day. We took them off of her the second day because she just didn't look right.
Okay.
But she's not eating. It's just not right. Something's a lot wrong with her. She is not well.
No problem. We're going to get this figured out for you. It's been about a week since Paisley gave birth to some pups. Anytime you're dealing with a new mom, you really worried about any kind of lethargy. You're worried if she's able to produce milk for the pups or if she's really sick herself. Yeah, runner fever.
What is it?
It's 104. She's super dehydrated. I'm going to start some fluids, but I am worried about eclampsia where they don't have enough calcium while trying to produce that milk. They will give up their whole body to the point where they don't have enough calcium to even move. Eclampsia is when the blood calcium levels drop to really dangerously low level in nursing mothers. This can lead to seizures and other problems, and it definitely can be life-threatening. Let's go ahead and get some fluids. Let's get some blood. Be right back, okay? I'm gonna grab some blood for a CBC and a serum chemistry so I can check the white blood cell counts as well as the calcium levels. Hey. Mom will give up everything for their babies. And what happens is when they don't have enough calcium to get eclampsia, and it goes downhill really fast. It's definitely a potential of life or death case.
I got your blood work, Doc.
This is not good, Paula. Let's go do an ultrasound. It's showing a really, really high white blood cell count, which tells me there's a really bad infection going on. I want to take a look at the uterus with my ultrasound. I'm worried if we have a retained placenta. That uterus is definitely swollen now, Paula.
Oh, man.
See it right there. I think we got some placenta in there. Let's go ahead and start those antibiotics, IV. We'll start some fluids. I'll get some calcium to get started. We gotta get that slow.
Yes, sir.
All right, so we do have eclampsia, but another little problem. Do you remember if you seen the placentas come out? You know, the baby's being a little sack.
Everybody came out with a sac.
We got a really infected uterus. I'm gonna start some antibiotics. I'm gonna get this baby feeling better, then I'm gonna go in and take that uterus out because I think that's the source of your infection.
Oh, gosh.
I thought she was too young. It's all right. It's all right. This is what I do. That's all right. My job is to make it better.
My husband died because he had an infection. They gave him an antibiotic, and he went into cardiac arrest. So please,
Yes, ma'am.
I don't want to go through that again.
Yes, ma'am.
Sorry.
It's okay. But this is gonna be tough, you know. I'm really sad. I can hear in her voice how sad she is. She got Paisley to help her recover from her husband, and now she possibly could be losing Paisley. We gotta get you home to your mama in one piece. Hey, you looking a little better. My game plan here is to do a hysterectomy. I wanna get this dog on the table and off the table.
Got it.
I got a strong feeling that we have some issues going on with this uterus. This is definitely gonna be touch and go. I can feel a piece of this placenta in here, man.
So that thing been in there since what? Third?
Yep.
What's that?
I think I found our problem. This whole uterus is ruptured here. It's leaking into the abdomen. That thing has a hole in it. And we had a piece of the placenta here, and we take that whole uterus out. Good thing we went in. Hang in there, puppy dog. All right, my man, I have done my part. I'm pretty sure that hole came during delivery. You know, maybe it was a hard delivery, maybe a pup punctured it, but it was draining close to the abdomen. And now we got the source of the infection. We started antibiotics to get rid of the infection. I think we got a good shot. How we looking?
She's finally waking up.
Let's get Mom on the phone. Welcome back. Hey.
Hey, I'm sorry. How is she doing?
She is doing fantastic. Not only was there a piece of placenta, there was a hole in the uterus that was leaking pus inside. I am looking at your baby waking up. I feel very confident we're gonna be fine.
Thank you so much.
I'm gonna keep Paisley here for the next couple of days so I can monitor her and give her antibiotics. But I can breathe easy, you can breathe easy, this baby's breathing easy.
God bless you. Thank you so
Thank
much.
you.
Thank you so much.
All right.
Thank you.
All right.
Okay, bye-bye.
Definitely can feel her joy through the phone. Paisley's not 100% yet, but I'm optimistic that we should be able to reunite Paisley and her mom real soon. I think we saved this dog's life.
Well, you got poop on your nose, man. Now we have another one of those all hands on deck episodes, but this case is not an emergency. We have 11 puppies that we have to check out, get weights, get fecals. So here we go. We need a poopy poopies. I know you don't like this, and my name is Andrea Wallace. All right. You just in time. We only did one so far. Come on.
6, 8.
You do realize I got my own cases, right?
Did you see what I sent up, the CF bat signal? All hands on deck.
Oh my God, you're so cute.
Heart and lungs right here.
Sir Grimsby.
Oh, you the runt here, huh? We're gonna let you go with Drill, cause one thing she will do is feed you. Okay. Next up,
This is Scuttle.
you look like Grumpy. Thank God for all the employees with all these babies coming through.
Right.
Everybody been checked out?
Everybody good
All
to
right.
go?
Everybody
All
follow
right.
me. We in line. We're going back. We gotta do like this.
Diesel. You're a big old dog. Wait a minute now.
You guessed wrong.
And who came up with this name?
It was me. But I did not know what type of dog I wanted. Then I saw him and I was like, that's him. So yeah, this is Big Diesel. I brought Diesel in today to check for bladder stones because he has had a history of them in the past and to get his vaccine.
Has he been urinating frequently?
He's still urinating fine. He's not having any signs that he has any active stones, but I do like to get it checked every year. He actually had 2 surgeries. They ended up rerouting where he actually urinates from.
Okay. Have you changed his diet?
He's on the special food and everything.
We're gonna just check his urine and just make sure ain't no stones in there.
Okay.
I'll be back, okay?
Okay.
Come on, Big Diesel. Diesel has had not 1, but 2 surgeries for bladder stones, and really hoping this dog doesn't have them, because if you made incisions inside his bladder, there's definitely scar tissue and the bladder is thickened, and this could be a really big problem. I want to take a look on the x-ray as well as do a urinalysis.
He's really short, so we gotta be quick. Go potty.
All right, that bladder looks clean. On the macro level, there are not any stones. That doesn't mean we don't have crystals, and that's what the urinalysis will tell me.
Your urine results.
All right. Well, no big eyes on the x-ray. The urine looks fine. Everything is negative.
Okay.
Diesel has nothing wrong with his urine. He doesn't have any urinary stones, so I'm super happy about that. Now, we just have to give him his annual vaccination.
All right.
Come on over here.
Come here, baby. Last couple things.
It's okay. I'll get you.
okay.
They get all your treats when you get home.
More?
All right. And these will be the last things.
Really? These will be the last things. You're fired.
Have a great day.
Thank you. You too.
No more.
I'm relieved. I just hope that he continues to be the happy-go-lucky dog that he is, with all the energy, and he just stays with us for years to come. He's a good baby. Come on.
Big girl.
It's really cool to see cane corsos. You know, you don't see a lot. Noah, go get Bane. I've had my cane corso Bane for about 6 years. And a lot of times people are a little scared because they kind of think of cane corsos as being a little bit aggressive. But Bane comes into the clinic and he's sweet as pie. Come on, Bane, I want you to meet someone. You gotta be on your best behavior for your new girlfriend over there. Look how pretty she is.
She's like, who are you? You big, handsome fella.
No, he's more interested in lunch.
Come here.
Hello, hello.
Hi.
How you doing?
I'm doing well.
Hey, Maximus.
How old is he?
3 months.
3 months.
You got a pop, don't you, buddy?
Oh, man.
Bringing in my puppy. Got a little spot on his nose. Just a little worried that might not be good news that I get. When I got him, he had a little white dot.
Okay.
And it's just gotten worse.
Yeah. 1.5 centimeter maybe, and it's raised. It kind of worries me because of the age, and we're not that old. You know, a lot of times older dogs will develop these little growths and things.
Yeah.
Maximus has a very peculiar growth on his nose. It's rather large and it's very concerning because we're still a puppy. So we definitely need to attack this aggressively.
Yeah.
You know, it's not one of them things where we need to watch it and see how it goes.
Yeah.
We need to get it off. Have you eaten this morning?
Around 6.
Okay. Schedule it for in the morning because we don't want food on the stomach once we give an anesthesia. Just like humans, you know, giving anesthesia, we don't like to have anything on the stomach because we do run the risk of regurgitating and aspirating material, and then we can have issue with pneumonia. So we want that stomach to be empty. Let me take the baby back, and we're just gonna get some blood drawn because we like to run blood and know what we have going on before we go into anesthesia, and then we'll come right back in.
Okay.
All right, let's go, buddy. Very concerned, so I want to go ahead and remove this growth, send it to the lab, get a definitive diagnosis so we'll know how to proceed further. But right now, we're going to go ahead and run our pre-anesthetic blood work. Hopefully this thing is benign, but we really won't know until we get a report back. All right, Daddy. We got your pre-anesthetic blood work drawn. Okay. We'll get that ran today. You can feed today, but just take the food up tonight, 7, 8 o'clock, and don't feed anything in the morning, okay? All right. See you in the morning, okay?
All right.
All right, thank you, sir.
I'm hoping that this will be benign.
Doing okay?
There you go. And if it's not, then we're just gonna have to do what we have to do. Make sure that he's okay. I'm gonna take care of my buddy.
Come on, fat.
Maximus returns with an empty stomach, ready for surgery.
It's okay, thank you, thank you.
My concerns are to make sure we get large enough margins in this area, which means that I need to get enough of the perimeter around that if it does come back cancer, then I've taken all of it out of that area. All right, buddy.
You want me to hold this back for you?
Yeah. Oh, man, this thing don't look good. It's bigger than I thought it was. All right, there it is.
container.
Patient doing good? We're gonna pray for positive results on this little baby. All right, last stitch. We can start waking the baby up. We just completed our Maximus surgery. Everything went well. The growth was a little bit more invasive than I thought it would be under the skin, but we got it all removed, and now we're gonna send it in to the pathologist, and we have our fingers crossed that we get good results back.
Hey, Doc. Come here. Look at this little growth. You see?
Yeah, you're right. We better take this off too. So Jordan discovered there's another little small growth in the ear, so we're gonna give a little bit more anesthesia, hold down for a second, and go ahead and remove that growth while we're here. Definitely glad she caught it. I'm calling her Eagle-Eye Jordan. She found this thing, which is good, because if it had grown bigger, we would be back in surgery, and now while we're here, we got it. We can send that piece in too and see if those things are associated.
Same jar?
I'm proud of Jordan for finding this other growth. It's not as large as the one on Maximus' nose, but it's large enough for an animal that's 3 months old.
Oh, you're still a little dizzy.
Better safe than sorry. We can have this growth analyzed with the one from the nose and find out if we're dealing with something cancerous. Hey, got your baby here.
There's your baby.
Got a few little stitches on the nose. And also, with the good eyes of this young lady, he had another growth too. So we took that out too while we had the baby back, okay? Those stitches will come out in about 9-10 days. Okay, everything went well, so we'll get that sent off to the lab, okay? As soon as we get it back, we will give you a call.
You want to carry him out?
Sweet baby. Thank you, sir.
Thank you.
All right.
Very worried at the beginning, but looking 100% better. Now we're just waiting on the results and just keep hoping and praying. Please, let it be benign. Come here, go to Daddy. I'm doing okay.
Jordan!
I swear I cannot keep up with him.
What you doing here, Doc? Good morning.
Morning. Can't check on Paisley. That dog had me quite worried.
She had all of us worried.
It's about 24 hours after surgery, and even though today is my day off, as a veterinarian, it doesn't stop. I constantly think about my patients. Even though I'm getting updates, I want to come lay my eyes on certain cases, and Paisley's definitely one of them. Hey, Paisley. How are you? I see you ate. His dog was on the brink of death 24 hours ago, and now we're eating and feeling better. Our temperature's down to normal. Hey, came in on my day off just to visit with your baby.
Peace. Oh, hey, puppy. She's alive again.
Oh, yeah.
I feel the energy.
She's eating?
She is.
Yes, so she's doing better. She has to stay here a few more days. I'm giving IV antibiotics. I have to make sure she reaches her peak recovery. Some days it's high stress. Some days you feel like, have you done enough? But on days like today, it definitely makes it feel like it's definitely all worth it. You spent some time with her. I just wanted to come in here and see you.
Oh, you want that belly rub, don't you? I'm just glad things have turned out the way they have. As far as I'm concerned, they didn't just save Paisley, they saved me. These guys saved me. I miss you. Oh, you look so much better.
Hey, it's okay.
A couple awaits evaluation of their pet rodent, whose chin is anything but chill.
My chinchilla, Dio. He's very cute. Dio is actually short for Diego, and that is a reference to a comic series that both my girlfriend and I are heavily into. He's usually very energetic. Anytime we feed him or try to play with him, there's a very good chance he's gonna try leaping out of his cage and just running around our room. But I'm concerned about the little guy. Lately, he hasn't really been eating as much.
Hey, y'all. Hello. Hi. Tell me about this baby.
Lately, he hasn't been eating as much as he normally does. And we also started noticing some matting under his chin, specifically coming from the right side of his mouth there.
Poor thing.
How long y'all had this baby?
Since about June.
Yeah. It's okay.
Chinchilla's definitely ranked pretty high. Other list of pets I like to treat. We don't see a whole lot, so anytime we get the chance to treat chinchillas, it's really cool. Have we been acting our normal self?
For the most part. He's not lethargic or anything. He's just not eating nearly as much as he should. He's not chewing on things as often as he usually would.
Has he been scratching?
A little bit, yeah.
Yeah, he'll like rub his face on like any of the pieces of wood that we have in his cage for him to chew on.
What do we usually eat?
He usually eats the pellets.
Okay. All right, good. Let me see those teeth. One of the initial things I always worry about in these guys is possible dental disease. They're very common. I don't see anything. So I may have to give him a little anesthesia so I can get back in there. Give me 1 second, okay?
Okay.
Come on, sweetie, it's okay.
A chinchilla has a really small mouth, so you really got to give them a little something to relax them and sedate them so we can get a really good look.
There you go. It's okay. I am getting this baby set up in our anesthesia box to try to get him nice and relaxed so Dr. Hodges can do his exam. It's definitely harder to give anesthesia to an exotic that you don't get to see every day. You have routines for cats and dogs that we see every day, all day. When you have something different, it puts you on your toes and a little bit more stressful. All right, we're rocking. All right, Doc, we ready?
All right, buddy. Let me see those teeth. Hey, bud.
What you see?
Hey, boy. Uh-oh.
What's wrong with it? Are you thinking abscess?
Oh, yeah. Got an abscess there. You see the blood, the irritation. I think this abscess is why you aren't eating. All right, here, wake him up.
Okay.
I didn't see any files or any rotten teeth, but I saw an abscess area right in front of the first area of dentition. Abscess come anytime you get in the pocket of bacteria, and this one is already pocketed, as well as some ulceration on the inside. I looked at the teeth.
Yeah.
Dio appears to have an abscess right in front of one. I'm gonna get him some antibiotics. I'll see if we can clear that abscess, because it is oozing.
Okay.
That's my game plan. Get you some antibiotics, and you'll be ready to go. Give me 1 second, okay?
All right.
Finding out that he has an abscess in his mouth sounds awful. Feel bad for the little guy. But on the other hand, it's a lot better than like needing teeth pulled.
All right. Which one of y'all gonna be my vet at home?
I can take care of it.
Come on. We're gonna go right there.
Come here, Dio. Open up.
Good job.
Easy
And I got
peasy.
some more for you. So you'll get it for the next 4 days.
Okay.
Amazing pit.
Thank you.
See y'all later.
All right.
All right.
Thank you.
Get your baby back up.
Here you go.
I could tell that they love this cute little baby, and with the antibiotics, we should get better really soon.
Start tomorrow, 4 more days. Take the cap off and do what you just did.
All right.
If anything changes or gets worse, please make sure you call.
All right.
Okay.
Thank you. It's a huge relief. As awful as an abscess is, it seems manageable. So I'm feeling confident that we'll be able to push past this. I'm really thankful.
I'm sorry.
A client drops off a chicken with a topsy-turvy condition.
Hey, Doc, I have Catherine,
Uh-oh.
a chicken,
What you got?
1-year-old chicken. I know. It's been like this for a month and a half.
Oh, man.
Started one day, and they said she's getting better and able to turn her head a little bit.
Okay.
Like, I guess how this is what they consider a little bit better.
Can she function and move on her own?
She can walk a few steps, and then she, falls over.
Okay. Catherine is presenting with torticollis or wry neck, which is basically twisting of the neck. And there are various reasons that they can have this. It can be from something bacterial, something viral, it can be nutritional. And usually when we get them, we just more or less treat them symptomatically, because some of these diseases that they have can only be diagnosed, necropsy, or if the baby's passed and they have to send samples in. Might be a little difficult, but let's see if we can get an x-ray.
Okay.
The best we can, okay? Let's see if we see anything abnormal.
Okay, let's go. I don't know if I've ever seen a chicken recover from raw neck. Usually they have like Merck's disease or something like that that is fatal eventually. You never know what she could have underlining that is causing this. She may get better. Fingers crossed.
Okay. Got a little food in the crop. All right, nothing too obvious there. So we took x-rays, and I don't see anything visible that looks like causing it at that point. So what we're going to do is treat several things. We're treating in case it was something traumatic by going on an anti-inflammatory, some antibiotic, as well as on nutrition. We're going to increase the vitamin D to be sure that we don't have issues there. Who going to hold this chicken head? This is my worst nightmare right here.
Hold on.
You going to grab his wing?
I'm gonna get him. I won't let him get you, Doc, I promise.
I want to slide on the side where your finger, you feel it over there?
Mm-hmm, right there.
Feel it under?
Mm-hmm, right there.
It's tough to diagnose exactly what's going on. Hopefully it's something that we're doing, we'll hit it and take care of it. We're going to make sure that the baby's isolated from the other one in case there is something that's infectious. But at this point, the prognosis is kind of guarded. We're going to treat. We'll recheck in a couple of weeks, and hopefully we're doing better. Okay. All right. Perfect. Now we wait.
Why are you over there giggling?
I just laugh when other people laugh.
You need some hay. I hear your stomach
The Moreaus return to Critter Fixer with their goat, who's feeling bad.
It hurt, Remy.
We're bringing in Remington today because he got a limp. He's one of our pets. We always take time throughout our farm chores to hang out with him. I mean, always. And he's almost like a dog.
Hi,
y'all.
Hey.
How are y'all doing?
How's it going?
Good.
Good to see you again. What's going on today? What happened?
Well, he woke up yesterday morning, that back leg is limping bad.
Like he won't
You just
even
noticed
put
it
it
yesterday?
down. Yeah.
Yesterday morning, yes.
Okay, it's all right. Don't hurt mama, don't hurt mama.
Thought it might be one of the bigger animals butting him.
Yeah, I don't feel anything that feel like fracture or break, but, you know, we need the x-ray to kind of take a look. It may be in your foot here. You respond right there.
Checking out Remy there, trying to localize where this area is. On the dorsal part of the foot, it seems like there's a little swelling, and it definitely doesn't like when I'm palpating that area. So that's why we're gonna start with x-rays. Bad.
You're not helping.
He's behaving badly.
You are not helping.
I'm sorry. I'm sorry. It was right there by the joint, wasn't it?
Right in there.
That one, yeah.
You don't like it right there. What is going on here?
Oh, look at that. Uh-oh. What you see?
I don't see a fracture.
Beautiful.
Okay, let's bring it back to mom and dad.
Did
All
your
right.
mama, your daddy?
So we got the x-rays. Good news there. Didn't see any fractures. But there is soft tissue swelling there. So we could have stepped in a hole. We could have got bumped on the area. Whatever it is, though, it's more of a sprain or strain. Okay?
Good.
We're going to give some pain anti-inflammatory medication, and we're going to send some home.
Okay.
Now, do you have an area where we can kind of be confined for maybe 3 to 5 days?
Yeah.
All right, so we're going to do that. So I'm going to give 1 injection a day, and then we're going to send 3 days home with you, okay?
Great.
Okay, thank you.
We'll get right back here. It's okay.
That don't hurt.
There we go.
All done. All done.
All done. Yeah. We're going to make you feel better in no time.
Okay,
All
thank
right.
you. I'm excited for him to get back to his full being Remy and run around and frolicking with all the other animals. And I think he'll come out guns a-blazing.
You're a good boy. You did great.
Hey,
You ever heard of Rin Tin Tin?
was it like a war type dog? Okay.
Go give me a kiss. Coming in today to find out what the results are on Max's skin cancer test, hoping that he's okay.
Hello, hello. How y'all doing? How you doing? How you doing? How you doing? You ready to get on this table? So how you been doing?
Pretty good.
Fantastic. All right, come on, let's go. Let's get up. Maximus is a 3-month-old puppy that came in and actually had a growth on the nose, which is something that's very strange in a dog of that age. So we actually removed it and we sent it in for a histopath. Maximus is back today. I'm getting ready to go in with the owner and go to the pathology report. Look good. Little scar to heal on up there. So we got news for you.
Okay.
Both came back benign.
Good.
The other good news is that we got everything out of there. It said complete excision. So everything is good.
No problem.
Yeah.
Awesome. I'm on top of the world right now. I'm happy that we have nothing crazy to worry about. He can continue being his rambunctious self and bring happiness to our family.
Baby's so sweet, too. So we definitely glad we had the opportunity to see you today. Thank you, sir.
Thank you.
All right.
I got you.
Y'all ain't gonna get me going today.
Hey, little puppy dog. Today is a special day. Paisley, man, a puppy that has captured everybody's heart is going home. I mean, it is a good thing. Somebody ready to see you.
Hey. Hey, baby. Look at her. Those eyes sure do look good. Yeah, she's a good girl.
So were you the one who got him?
Yeah.
You her daughter?
Yeah.
Oh.
And we had no idea.
I heard. Paisley is a very lucky dog. I'm gonna start some oral antibiotics, and hopefully she's gonna be fine. As a veterinarian, you work hard and you try to save every animal. But some cases just stick with you. Some cases tear at your heart. This is definitely a case that I'll remember for the rest of my veterinary career.
Thank you
so
Y'all
much.
have no idea.
Thank you so much.
I appreciate it. Thank y'all.
This has been quite a journey. It's been difficult, but the satisfaction of knowing that she has been properly cared for and cared by someone with the heart of the people here at Critter Fixers, what more can I ask? Thank you so much. Oh, you look so much better. You're acting so much better. Yes, you are.
stop.
He probably got the zoomies right now. He never calms down.
Hi.
Hey, hey, hey.
How are y'all?
How you doing? What's up, little one? How you doing?
Pet me, pet me, pet me. I'll pet you. Hi. How you doing?
So what's going on with the buddy here?
2 days ago, he pooped and had worms in it.
Oh, boy.
Kilo is 5 months now. He's an American bully. Pretty wild dog, got a lot of energy. My favorite thing to do with Kilo is probably like just run around outside with him. He's very playful. He gets tired very fast, so eventually he flop on the ground.
So what do worms look like?
I got a picture of it.
Okay.
Let's get you belly rub. Oh my gosh.
I'm gonna show you something here. If you look right here, you see where it kind of goes in and it kind of goes in. Those are segments, and we call those proglottids. Tapeworm.
Ew.
We need to get a sample to see if he has any other intestinal worm that can cause them to be anemic and even anemic enough to cause death. Okay. So we're gonna run this sample right here.
This is yours. You brought that? Okay.
Yes, ma'am.
Okay.
You ready, ain't you? You didn't want us to take it from your little man down there.
Daddy, looking out for him.
All right, we'll be right back.
It's gonna be okay, all right? We can get through this, Kilo.
They are parasites in the stool, what we call tapeworms. And tapeworm are intestinal parasites. Although they look very nasty, they don't cause a whole lot of pathological issues. But it also tells us that we have fleas, so we need to get on a parasitic medication. And we're also gonna take this stool sample, float it, to be sure that we don't have any other worms.
We're just waiting another minute to check the fecal float, but, oh, Doc, that poop smells bad.
Okay, and it may be from the parasites.
Nasty in here. A couple of roundworms. And then a bunch of hookworms.
Oh, boy, those can be a killer.
You want to look at this?
Yeah. The hooks are what we worry about. Oh, man. Tapeworms don't cause a lot of problems, but hookworms can cause anemia, nutritional loss, and ultimately they can cause these little puppies to die.
I'm sorry, poor thing.
All right, so we did a fecal sample. We did have other parasites, too. We had internal parasites with tapeworms, roundworms, and hookworms. And we have fleas as well. Hookworm's the one that would worry me the most because that's a little bit more deadly.
Goodness gracious.
That's the one that can attach to the lining of the intestines, so it can affect them nutrition-wise. It also cause them to be anemic because it's causing them to have bleeding.
It's okay, Kilo.
Let me look at him right quick.
Good boy.
Hey, buddy. You don't look at your gums here. You see how pink that is? And you see how fast it comes back? And that's good.
Yes, sir.
Yeah, all right. Good. We can rule out anemia. Now we can focus on getting rid of these parasites.
All right, yes, sir.
Come on, big boy.
Gonna get some medication, too. Take care of it, okay?
Okay.
All right, we'll be right back.
Yes, sir.
So I feel pretty good about this. You know, the baby didn't come in, didn't get on the medicine. This thing could have really gotten out of hand here in a few weeks. We're gonna take care of those hookworms with this powder here.
Okay.
We're also gonna get some medication too to take care of the fleas. And we got an injection here that's gonna take care of the tapeworms, which is what you saw.
All right.
All right, buddy, you ready for your shot? I don't even want to give it to you, man.
I know.
You've been so good. Don't be mad, man. It's Jordan's fault. It's not mine.
We're
okay?
friends.
All right.
We're friends. Good boy.
It's all over. It's all over.
Boy.
Everything should be resolved. We don't need any rechecks. Clean bill of health.
Okay,
Appreciate
sir.
you.
Thank
All right.
you.
Good, good.
Bye,
All right.
handsome.
Thank you.
All right, have a good one.
It's a big relief because they gave us some medicine and everything, so we'll be good. I hope you become a big and strong dog. I hope he stays playful. Boy, Kilo.
Well, there are some days I don't even know which I get more enjoyment out of, treating the patients or treating the owners.
Our slogan, we treat them all. Will we have to change that, or we treat people and pets?
Yeah, we treat both ends of the leash, owners and patients. We can't say leash when we have birds come in, have fish come in. We're gonna have a wraparound sign, LED that continues
You know what?
to.
We're just gonna stick with we treat them all.
I think that encompasses everybody.
That's it. Let's do it.
Doing so good.
How you doing?
I'm good. How are you?
All right. Who we got today?
My 2 guinea pigs. Their
Okay.
names are Goob and Moon.
Goob and Moon, okay.
My boyfriend was there when we were talking about naming them, and he was like, what if we name one Goob, short for Goober? And I was like, I kind of like that. And then for Moon, it just kind of rhymed, so I was like, yep, that works.
All right, so what's going on?
Goob has been sneezing a lot, so I want to give him an overall health check-in.
Okay, so let's see Moon first. How old are they?
3 months.
They're babies.
Yeah, I just got him this week.
Oh, you just got them?
New
Okay,
babies.
all right. Take a listen here. Up here. The lungs sound good. Okay, let me check the back end. I got you. All right, there we go. All right. I know you'd rather face this way, don't you?
Stop it.
It's okay. Doing good there. All right, let's switch up. Now I want to see this. The baby that's been doing a little sneezing. They've been eating pretty good doing so far?
So far, yeah.
Oh,
Oh, bless you.
All right.
Goodness.
Okay. You got some discharge, okay. They're so sweet. They just kind of chill back. I like that. You know, I'm not kind of guinea pig. That's what I'm talking about. So we are sneezing there. A lot of times they can indicate like a respiratory problem. And my concern would be that they both kind of together. Do you have any way you can keep them separate for a few days?
I could figure something out probably.
Okay. There we go. All right. So we definitely got a respiratory issue. It's more than likely upper respiratory. What I want to do is get an x-ray. And what I want to do is look at the lungs. Just make sure that the lungs look fine. It's not a lower respiratory because when these guys get sick, it doesn't take long for them to go down. So I don't want to miss that, okay? We'll be right back.
All right.
All right. With Goob, the lungs sounded good, but I know that they can still get respiratory issues that can affect the lungs, but I may not hear anything. So we want to take x-rays just to be sure. You look fairly well. Probably had already picked this up and just started showing signs since she's had it.
Can you sit in my pocket?
Did we make noise? That was you.
That was me.
Oh. You got a pocket full of guinea pigs. And we wanted to be sure that we didn't have issues with the lungs, something like pneumonia or lower respiratory issue. And the lungs look pretty good. I feel a little bit more comfortable knowing that because the fact that we don't have to be hospitalized, we can treat this as an outpatient. All right, good deal. X-rays look good, okay?
Good.
So we're just dealing with the upper respiratory. Now, the plan is I want to separate them for probably about 5 days. And we got 5 days worth of antibiotics here, okay?
Okay.
I'm gonna go ahead and give her first little dose here so we can get the baby. Get a little mouth of it and give it a little minute. There we go.
Good job.
All good. Definitely good sign by a new owner. She's only had these babies for about a week, but she picked up those clues and those signs that this baby is having some issues. She got them in time before they get too sick, and we can't do anything about it. So I feel real good about it. You know, I know the owner compliance is going to be good, and she's going to be a wonderful mother for a long time. Everything should be great. And just let us know how it goes, okay?
Okay.
All right, good deal.
Thank you. I feel pretty relieved about the diagnosis. I'm glad that I took him in when I did. Doctor and all the team was very nice, very helpful, and they were very sweet to the animals also. It was just a very good experience overall.
It's okay. You're doing so good.
Makes you feel real good to be able to treat the owner as well as the pet.
Speaking of, how's that goat with the limp?
That back leg is limping.
Yeah, you respond right there.
You mean Remington?
Yeah.
Remington is doing great, man. And the owner, Joe and Sharon, they're glad to have their baby back to normal.
Remington, come here. No cookie?
Hey, sweetie, buddy. Since seeing the doctors, Remington started walking. There's no signs of any limp, nothing. I mean, he's completely recovered.
You're not going to share?
He's back to his normal self. He's back into getting in trouble.
Remington? Remington.
I'm relieved that, you know, he's a lot better.
Come on, Remy.
When you walk around with them paperwork, I do try to avoid you.
Yeah, I know. You told me that before.
Hey, Doc.
Catherine the contorted chicken is back for her follow-up.
All right.
Catherine,
Who we got?
recheck.
Okay.
You remember Catherine?
Yep, Catherine the Rodneck.
Mm-hmm.
Yes.
So she doesn't look good right now, but in the exam room, I saw with my own eyes.
Okay.
She went from this position,
Yeah.
sitting like this, and she righted herself
Okay.
and was looking around. Yes.
All right, let's pull her out and maybe she'll show me something.
She's shaking her head no.
No? You saying no? No. Look at that. You just need a little assistance, didn't you? That's definitely better. Meds are up, so I'm not gonna give any more meds. We improving, so let's just continue to do that. All right, I am so happy. I didn't think we was gonna get this far.
Yeah.
I was really worried. When Catherine came in initially, prognosis was pretty guarded. We made a ton of progress in 2 weeks. I really expect the next couple of weeks, this baby will be back to normal and look. We're gonna be bucking in no time. Oh, okay, all right.
Look at her.
Oh yeah, we good. She stood up by herself.
I told
and
you.
it up.
A
Yeah.
time story.
Yeah.